Have you ever felt pressure or heaviness in the vaginal canal, especially at the end of the day or after a workout or standing for a long period of time? If so, you might be experiencing symptoms of pelvic organ prolapse. And I'm here to tell you that you're not alone. And today I'm going to break down what is pelvic organ prolapse, what are the stages of pelvic organ prolapse, and what you can do about it. My name is Dr. Brooke Kalisiak. I'm a pelvic physical therapist who is passionate about helping people optimize their pelvic health. So let's dive in. When we talk about vaginal prolapse, we're talking about a situation where the pelvic organs, the bladder, the uterus, or the rectum, start to drop down and press into the vaginal walls. This happens when the pelvic floor muscles and connective tissue that support the pelvic organs become stressed, strained, weakened, or even damaged. This is often from things like pregnancy, childbirth, chronic straining, or even menopause. The pelvic floor muscles are a bowl of muscles on the bottom of the pelvis that go from the pubic bone in the front to the tailbone in the back. So there's the back side there. So these muscles form a bowl at the bottom of the pelvis. And so a good analogy that I like to use is that the pelvic floor is the bowl that holds the pelvic organ fruit. So this is our bladder that would sit right up front here. And then our vagina and uterus would be right behind that. And our rectum and anus would be right behind that. So the organs are the fruit that need to sit inside the bowl. So we want a nice, strong, supportive bowl to support our pelvic organ fruit. When we don't have the support there, we can end up with pelvic organ prolapse. Now, pelvic organ prolapse is an extremely common condition. Some studies show that up to 50% of women who have experienced childbirth will experience some level of pelvic organ prolapse in their life. What a lot of people don't know is what are the symptoms of prolapse and how does the severity of prolapse affect these? And that's what we're going to go into next. Now let's talk about the different stages of pelvic organ prolapse. So if I bring up this diagram here, right here is showing a situation where the person doesn't have any type of prolapse. So let's orient ourselves. On the front here, we've got the pubic bone, and on the back here, we have the tailbone. And so from front to back, we have our bladder and urethra, our uterus and vagina, and our rectum and anus. And underneath them, it's hard to see in this picture, but is the pelvic floor muscles that kind of, like I said, is that bowl that supports pelvic organ fruit. Now in stage 1, which is considered very mild, we can see either the bladder kind of tipping back or the rectum starting to tip forward. But everything is up and inside the vaginal canal. There really isn't a big noticeable bulge at all. Oftentimes symptoms are even like extremely mild to even not even noticeable. Okay? When stage 2 happens, we start to get more tipping into the vaginal canal, and that bulge may be coming down closer to the vaginal opening. And this is a time where people might feel it more when they wipe or notice more of a discomfort or a heaviness with it. But in stage 2, the bulge from either the front or the back is coming down closer to the vaginal opening. In stage 3 here, we're seeing the bulge come out of the vaginal opening. And in this case, it's the bladder tipping back into the vaginal canal that is exiting out through the vaginal opening and pushing the vaginal wall onto the outside. And it's doing that just a little bit. And in stage 4, it's doing that quite a bit where the bulge is all the way on the outside of the vaginal opening. This is very noticeable. People oftentimes feel this rubbing on their underwear, and it can become dry and uncomfortable. So this is the most severe stage of prolapse. And it can be any of these pelvic organs or a combination of them that are creating the bulge. So in this situation, it's the bladder that's ultimately pushing all the way down and out, but it could be the rectum or it could even be the uterus coming down. And each of those have their own names. So if it's the bladder tipping back into the vaginal canal, that's called a cystocele. If it's the rectum tipping forward into the vaginal canal, that's called a rectocele. And if it's the uterus that's coming down from the top towards the vaginal opening, that's called a uterine prolapse. And many people wrongfully think that if they've had a hysterectomy, then they're no longer at risk for developing a pelvic organ prolapse, but that's not the case. Because you've had a gynecological surgery and that has changed around the support structures and connective tissue in the area, it actually puts you at a slightly slightly higher risk to developing a pelvic organ prolapse. In this case, though, we don't have the uterus to prolapse down, but we have the vaginal vault, which is just the top, the vaginal canal that kind of ends at the top, that can actually start to tip down and turn inside out on itself. Or we still have the bladder or the rectum, and either one of those can tip backward or forward into the vaginal canal. So now we just talked about the stages of prolapse as well as the different types of prolapse. Now we're going to go through a little bit more about what you can do about it. If you are experiencing symptoms of heaviness, pressure, fullness, urinary or bowel changes, don't ignore them. Early intervention can help you prevent things from getting worse and help you return to activities you love with confidence. Research has shown that in the early stages of pelvic organ prolapse, pelvic physical therapy can be extremely effective at helping you manage and overcome your pelvic organ prolapse symptoms. Pelvic physical therapists can work with you to help assess what's going on with your pelvic floor and abdominal muscles, how you're managing pressure in your abdominal cavity. We're going to look at things like your posture, your breathing, how your muscles are coordinating together, what you do when you're lifting, what you do when you're doing your favorite exercise. We're going to take all this into consideration to help develop an individualized treatment program to help you get back to being active without having to worry about your pelvic organ prolapse symptoms. Pelvic physical therapists are also going to be an awesome resource to talk to you about lifestyle modifications to help you manage the prolapse. So we're going to talk about constipation management so that we're not stressing and straining when we have a bowel movement. We're going to talk about body mechanics for lifting and exercise, and even when we're sitting on the toilet so that we minimize the stress and strain down through that pelvic bowl. We're going to also talk about potential use for support devices that are called pessaries to help support the vaginal tissue up and in where it needs to be. And we also can be a sounding board and discussion point for whether you're an appropriate candidate to look into surgical options to help repair the prolapse. So a pelvic physical therapist can be a wonderful partner to help you decide your next course of care and how you proceed forward. And oftentimes, pelvic physical therapy is the only thing that you need to help you get symptom-free and being active with confidence. But sometimes they could serve as that guide that you need to help you make those more difficult choices. At Legacy Physical Therapy, we work with women who are dealing with pelvic organ prolapse all the time. So if you're local to St. Louis, you are in good hands. Reach out to us to schedule your pelvic health assessment to figure out what's going on specifically in your body so that you can get back to being active without having to worry about pelvic pressure or heaviness. Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.